affaire corona bi yëg naa si bu bari ndax tax na liggéey bu bari nit ñi bàyyi nañ ko duñ jaayati duñ dem fen ku waroon a ñëw si yow indi la dara du ñëw sa doom yi ñu ngi waroon a jàngi duñ dem yëpp taxawoon.
parce que dañu closoon mbiri jaay bi kenn jaayu waaw kenn jaayu doon.
Because when you are working because of the people, but when there's a coffee, you don't see people in your workshop.
There were development programs that were to be implemented, but because of the corona, we had to shift our priorities and concentrate more on corona prevention and in the fight against corona. So for that being the case, also it has also affected our social interaction through this social gathering.
Well, I think the main challenge is economic, because really it hit very badly the earnings of our artists and the heritage sector. I mean, the restrictions didn't allow for gatherings, and where you don't have gatherings or audiences, there cannot be art.
ala min de mi suwayin hawru bore nanade e mbeɗaɓe kono minen mi suwayin hawru te waɗi ɓe koddumi ɗe kewɓe ɓe mbi ɗe ɓe tina ɓe kawra hen min kay he o tan woni mi caam tan ɗo tan nanggumi kono mi heeɓa hen haydara
ndimbal boobu noonu bu ñëwee fii nekkut ñoom ñoo koo jot parce que am na foofu fu ñu leen ko tegee yow doo ko gis sax loolu moom mu ngi fa.
Some people will have it in the same community, others will not have it because of reason best known to them. But I would describe it as discriminatory because they are just following their political supporters. They are just following their people that they believe that they can attack them or they can get them if they give them such support.
Financially, they once gave us some allowances as staffs. Okay, that was when there was a lot of pressure on government. They gave us first 5,000, and after they gave me 10,000. Yes, that was 2020. But since then, everything stopped. Even now, people are complaining about those COVID allowances, but nothing is forthcoming.
Face masks was one of the materials that was received, and that one we received abundant. That one was enough. Yeah, but other than that, there was no other material that was supplied in tackling the virus.
déedéet loolu moom ñun joxuñ ñu ko ñun ñoo defal suñu bopp rek bi ñëwee daa wane ne nañ wut suñu masque ñu wutal suñu bopp. déedéet amagul soblaay moom boobu moom amagul soblaay dem na ba sax ba ci tuwo yi xale yi nga xam ne ñoom la ñooy peesee noo si wax nañ ne nañ kenn ku ne na am sa tuwo yi bopp.
The only resources here we receive from the Ministry of Health and Government is face mask and the PPEs. Okay, apart from that, sometimes they bring detergents like soap, okay, these spirits alcohol spirit where you wash your hand. Those materials, safety precaution materials, are the only thing. Well, there was a time I even complained about the RDT that we use for COVID testing, but we are unable to get any supply from the central government or from the Ministry of Health.
waaw ni ñoo aaree suñu bopp ñu ngi ci ndax ñu ngi doon takk suñuy masque ñàkk bi it bi mu jotee itamit jog naa ma yëgle ci dëkk bi nañ dem ñàkku ji ñi njëkk a ñàkku yëpp kër Thierno lañ dem ci lopitaan bi ñu ñàkkoo ji fa waaw moom wax dëgg dëkk bi moom ñàkku bi moom caaxaane wuñ ko boobu moom fi ne mën naa wax ne dëkk bi mën naa wax ne daj na.
Presente la sokolo be yatar momo sita tabe be yatar kabilo kono mojama wala yata kala mojama wala benta je tata
ndelle ko dem mo folo de na mo fala ben delle folo fala ko ko wonde heltu le do ko la so ko wolle folo nyata tala jandi mo do batala ndelle folo yata.
And then washing my hand, because even today right now when you go to my compound still now you will find the bucket with the soap and everything there for the protection. And then whoever I saw that I'm not sure of, I see you, I'm not sure of you, I will ask where do you come from. So in case I do work with the hospital, I just call the person at the hospital, then come and see who you are and where you're from.
With the Bansan Hospital here, we make sure we put things in order to improve the service to minimize the pandemic. One of the key is that we also all try to follow the PPI, put on a face mask, try to avoid social distances, and other things like that.
What I understand, when Corona just came, the way people were, going with the preventive measure, and now it's totally different. Because you can see during the time, villages, people will sponsor rice, soap, whatever sanitary material, but it's no more happening. It's like Corona is gone, or they don't fear Corona anymore. But still, Corona is real and is existing, so we just have to accept that and understand that and follow the preventive measures that are in place and try to avoid, too much of crowd or whatever. Even if we are in a crowd, but let's try to get our face mask.
There are still people in the community that did not believe the COVID exists in the country, which we, the public health officers, we are really trying both day and night.
One thing that is affecting us mostly is the information, because there's no consistency in the information that we are giving. That's the reason many people will not believe or are difficult to convince, because the information they are receiving from different sources is not consistent.
COVID, but there's no specific training for COVID and how to care, how to manage. They just send you information or booklet. You will sometimes understand, you may not understand, and that's why it's so regular. It's time to time. When you complain, they say funding. You cannot print. You don't have money to call. Okay. But other areas like will keep on functioning. Even myself, I used to tell my staff, I don't know this COVID. We should be trained. In those days when there are outbreak of diseases, nurses are trained. Concurrently everybody is put on board. But this one, I don't know what's happening.
Lima wax waa Gambian si mooy nañ topp digal ak bépp mbootaay bu mën a doon ak bépp kilifa gu mën a doon lam laa digal topp ko comme ñun wér-gu-yaram mbiri ñun ñii liggéey ci wér-gu-yaram ñoom lañ yaakaar li ñuy sant lañ ko def ñu am suñu noflaay ñu am seen noflaay.
And government should come up with strict rules even for themselves and for the parliament, for people to understand and accept that this disease is factual and it's happening and it's here to stay. So there should be measures, trainings and counter trainings for all levels of the society, not even healthcare workers.
With this Corona, if we don't just get rid of it, it will even delay our development. So for that being the case, I'm encouraging and appealing to every Gambian to go and get vaccinated. So with that, I think we can live in a very healthy environment. Then we can also participate in the development of our country.